Hello. Welcome. So sorry about that. I was just finishing up a report for a previous patient. My name is Evie and I am the sleep clinician here at the ASMR Tingle Sleep Clinic. Is this your first time here? Yeah, I didn't recognize your name and I usually see all the patients, so I figured. Well, what brings you in? Okay, so your doctor referred you to us for sleep issues. Well, that is what we specialize in here, so you've come to the right place, and we're excited to help you on your sleep journey to make sure that you are sleeping to your fullest potential. Sound good? Okay, wonderful. So the way that our appointment is going to go today, since it is your first time, is we will be doing a baseline intake. I will be giving you a questionnaire, asking you some questions to get to know more about your sleep hygiene, your lifestyle, sleep habits, and then from there I will also do a general wellness check just to see if we can rule out any sort of physical issues that may be getting in the way of your sleep. And from there, we can talk about suggestions that we may have and how we may proceed and move forward from there. All right? Sound good? Okay, wonderful. So I'm just going to go ahead and grab my clipboard and we can get started. Alrighty, I've got my clipboard right here. And this is, again, just our basic intake questionnaire. I'm going to ask you questions about your lifestyle, your sleep habits, and your sleeping environment to see if we need to make any easy changes there, okay? So, to get us started, could you please spell your first name for me? Okay. Great. And then your last name, please. Wonderful. And can I please get your date of birth? Date of birth. Okay, great. Alrighty then. So I see we have all of your insurance information on file. You took care of that at the front, so we don't need to go through any of that. So let's just go ahead and dive straight into our questionnaire here. So first, I have questions about general lifestyle. And the first actually has to do with daytime habits. So, how much sunlight do you think you would get during the day? In hours. How many hours do you think you get of sunlight? Okay. And then, how many hours of screen time would you say you have per day? And then, do you use your screens all the way through bedtime, or what time would you say you stop using it? Okay. Alright. Next question is, do you drink caffeinated beverages like coffee, soda, black tea, or green tea throughout the day? Okay. And how many drinks would you say you have during the day? Okay. And what time do you typically have the last drink? The next question is, what time is your last meal in the evening, including snacks? Okay. And how long is this typically before you go to sleep? Okay. How often do you nap during the day? Okay, alright. And then how long would you say these naps tend to be when they happen? How often would you say you exercise? Okay. What time of day do you tend to exercise? Okay. So next, I want to ask a little bit about your sleep habits. So first is, what time do you usually get to bed? Okay. And how long does it usually take you to fall asleep? Do you tend to wake up at night once you have fallen asleep? And how often would you say that happens? Okay. What time do you wake up during the week? To go to work, school? Okay. And then how about on the weekends or your days off? Okay. And then do you tend to sleep on your side, back, or your stomach? Okay. And in terms of previous diagnosis, do you know if you've been diagnosed with sleep apnea before? Okay, how about acid reflux? And then do you know if you snore throughout the night? Okay. How often would you say that happens? Okay. And then the last little section here, I just wanted to ask about your sleeping environment. So, would you say that your bedroom tends to lean hot or cold in the evening? Okay. And how about your mattress? How long would you say you've had your mattress? Do you find it to be comfortable? Okay. And how about your pillow? How do you feel about the pillow? Do you think it's doing a good job? Okay. Do you sleep next to anyone, like a partner or perhaps a pet? Okay. And do you find that their sleeping habits keep you up or disturb you during your sleep? And then finally, at night, do you tend to prefer silence or do you listen to some sort of sleep aid like relaxing music or ASMR? Okay. So ASMR stands for Autonomous Sensory Meridian Response, and it is actually one of our specialties at this sleep clinic, which is why it's named after it. And we can definitely talk a little bit more about the triggers that may be working for you. I think I'll do our baseline assessment first, and then we can talk about recommendations. How does that sound? Okay, great. So I'm just going to put this down. I'm going to get out my little stethoscope here. Alrighty, so I have my stethoscope here. I'm just going to gently slip this under your shirt. It might feel a little bit cold at first. Okay, yeah, there we go. And now what I want you to do for me is breathe in deeply and out. Again, breathe in deeply and out. Very good. Now I'm going to go over to the other side. Okay, breathe in deeply for me. And breathe out. Breathe in deeply one more time. And breathe out. Very good. Okay. So it seems like your lungs are doing okay, which is wonderful. And now I just want to take a look at your vision, your eyes. I'm going to test your pupil reactions, okay? So I have a little light here. It's going to be a little bright, but we're going to be doing a few little things with it, okay? So first, if you'd please just keep looking at the tip of my nose, or where you imagine it would be if I weren't wearing a mask. So keep on looking at the tip of my nose, and I am going to test the periphery of your vision and see how your pupils react to that, okay? Alright. Alright. Just keep on looking at the tip of my nose, please. Okay. Right here. can be a little distracting, I know. Okay, wonderful. Okay, so now I'm going to do something a little bit different, alright? And I actually want you to follow the light. I want to track the tracking movement of your eyes, okay? So just do me a favor, and when you see the light come into your field of vision, just follow it, okay? Okay. Good. Very good. Very good. Okay, that all seems to be in order. And if you can just do me a favor, and similar to before, just make sure that you're focusing in one location. I want to get a closer look at the eyes, okay? So it's going to go through this magnifying lens so that I can see a little bit more clearly, okay? Okay, again, it's going to be a little bit bright. Taking a look at this. It's looking pretty good. It's looking pretty good. Okay, and then let's take a look at this side. Okay, it's looking good. Okay, seems like you're doing pretty well there as well. And then finally, if you'll allow me to, I need to conduct an exam of your lymph nodes. You have some at the base of your throat as well as behind your ears, so I'll just be gently examining them, okay? And of course, safety first. I do have some gloves here that I'll be using for the examination. Alright, I've got them on. So I'm just gonna come over here and gently massage under, the throat area. Just gently see what's going on here. Okay, it feels pretty good. Nothing seems particularly activated, which is good. So now I'm just gonna gently check behind the ears. Gently behind the ears. Okay. Okay. Seems like we're doing well there as well. And then I'm just going to gently touch your face, okay? Just gently make sure that we're doing well over here. Okay. 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 So I'm now going to put my hands on your chest and your back, and similar to before when I was listening through the stethoscope, I just want to feel what's happening with your lungs just to make sure that everything's okay, alright? So I'm going to place my hands on your chest and on your back, and you're just going to breathe in just like before, and I will prompt you, okay? Alright, breathe in, 2, 3, 4, and out, 2, 3, 4, 7, 8. Yes, good job. Let's do that one more time. 1, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. Wonderful. Good job. Let's just do that one more time. I think you're okay, but I'm just going to reposition my hands slightly, okay? In, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. Wonderful. feels physically okay. So you are in good health for the most part. There are some suggestions that I would like to make based off of the intake questionnaire, and then we can continue to monitor you just to make sure that things sound okay. I have an app that I'm going to tell you about that can help keep track of your sleep. And then from there, we can make any decisions about potential treatment options if they are needed. But first, I just want to talk about some simple lifestyle changes you can make that can hopefully help support better sleep hygiene and will help you fall asleep a little bit easier, okay? And like I said, we will monitor you for a few weeks. And if things don't improve after making those little changes, then of course we can follow up with more intensive interventions, okay? Wonderful. So I'm just going to slip these off really quick and we can take a look at your questionnaire together. Okay, so I asked you earlier about some lifestyle changes, and there are a few things here that we can improve on. So in terms of sunlight, you may be wondering why that was a question. And sunlight exposure during the day actually helps regulate your circadian rhythms, and that is what determines your sleep cycles. So make sure that you're getting ample sunlight during the day, at least a few hours if you can. I know it can be difficult. Over here, I mean, all of us are attached to our screens every day. It's kind of inevitable in the society that we live in, unfortunately. But I did just want to mention that it's really best to not use any devices 30 minutes prior to going to bed. A big reason is because the blue light that emanates from devices actually gets in the way of the circadian rhythms that I was talking about. So if you absolutely must use your devices until bedtime, I would recommend dimming the blue light. So there are features on most phones and screens now that filters out blue light. It makes it warmer, and that can help with that. But again, I do recommend just not using it entirely if you can in those 30 minutes leading up to your sleep. Okay, over here we have caffeinated beverages. Try not to drink anything caffeinated within a few hours of going to bed. It's really best to not do so in the late afternoon or evening. I'm sure you knew that. Last meal. So you tend to eat a little late for my liking. I would recommend trying to eat maybe an hour and a half earlier than you already do. And the reason for that is because when we eat later, especially if it's acidic food, it can lead to acid reflux, which can disturb our sleep. So we don't want that. Of course, napping, if you're having issues sleeping, which is why you're here, I really wouldn't recommend naps during the day because it really throws off those sleep cycles. So try not to do that. And then exercise. Exercise is so important for making sure that we're having ample sleep. It tires us out. However, I don't recommend exercising right before bed because it can give us a dose of energy as well. So if you're exercising, try to make it a little earlier in the day. Okay. So for sleep habits, you're doing a lot of really wonderful things. I would just recommend, and I know this is very difficult, but you tend to wake up at different times during your work and school days than you do during your rest days. And just to make sure that your cycles are healthy and regular, it is helpful to try to wake up and go to bed at the same time every day. regardless of whether you're getting up early for work or school, or if it's a rest day. I know this can be difficult. We want to sleep in on our rest days, but maybe just try it for a few weeks and see if it helps improve anything, okay? Alright, let's see over here. Sleeping environment, I wasn't too concerned about anything, but the one thing I did want to mention is this last question I had about silence or sleep aids. So I know you mentioned that you were familiar with ASMR, but I am a really big proponent of it. I know some people need silence, so if that is you, that's totally fine. But if you do listen to ASMR, I highly, highly recommend listening to videos that are a little softer, not quite as frantic, okay? Nothing that might have any sort of alarming sounds in the middle of it. So really trying to explore different ASM artists that are on the quieter, gentler side, that aren't going to create any disturbances for you in the evenings, okay? Alright. So the last thing I want to mention is that we do have an app that's associated with our clinic. We will be sending you an email with how to download it to your phone, but what it's going to do over the next few weeks is you are going to leave it on your bedside table, and what it's going to do is it's going to monitor your sleep activity, and we're going to be able to assess that data and see if there are any sorts of patterns in terms of waking up, if there's any sort of heavy snoring at certain periods, and so that's really going to help us get a better sense of what your sleep cycles look like, and make any sort of further recommendations, okay? So what I recommend, we've talked about suggestions, and I'll be sure to type them up and email them to you as a post-appointment summary. So I'll include all of the recommendations that I just mentioned. But if you can please do me a favor, and for 3 days, just 3 days, just continue to do things as you have been, your normal habits, and then use that sleep tracker. We will take that sort of as a baseline measurement, and after those 3 days, I'll send a reminder. I'd love for you to implement some of these suggestions that we talked about and see if it makes any sort of difference in your sleep habits. We'll be receiving that data from the app, and then you can schedule a follow-up appointment with us, and then we will take a look to see if the data changed, if there are any additional recommendations we can make, or if there's no significant change, really go into a more intensive intervention. How does that sound? Good? Okay, wonderful. Well, thank you so much for coming today. It's been an absolute pleasure meeting you. And if you have any questions, again, you will be receiving emails from me, and they do come directly from me. So if you have any questions, you're always welcome to reach out, email me, and I typically respond within 24 to 48 hours, all right? Well, wonderful. Thank you so much for coming to our clinic today, and I hope you have a wonderful